Hey, welcome. Today we're doing a deep dive into allergies. You know, the sniffles, the sneezes.
The usual stuff, yeah.
But we're going beyond that, looking at some maybe surprising ways allergies can pop up.
Mm-hmm.
We've been digging into some medical summaries, some research, try to get the bigger picture.
Right, looking at what the science says about how allergies can affect more than just your nose.
Exactly. So, have you ever had like a scratchy throat and wondered? Or maybe noticed your face felt a bit puffy?
Yeah, things you might not immediately blame on allergies.
That's what we want to unpack today, sort of map out these less common signs so you can understand your own body a bit better.
Sounds good. It's easy to think of symptoms in isolation, right?
Yeah, totally.
Get a sore throat, you think, must be a cold coming on.
Standard reaction.
But the information we've looked at, it clearly shows allergies can cause sore throats too. It's not always the first thought, but it happens.
Okay, so it's not just colds then. How do allergies actually cause that soreness?
Well, one common way is through postnasal drip. When you have an allergic reaction, your body often makes extra mucus.
Ugh, yeah.
And that mucus can, drip down the back of your throat from your nose.
I can picture that. Just irritating.
Exactly. It causes that scratchy, kind of raw feeling. Just mild irritation, mostly.
But is that the only way? Or is there something more direct?
That's a good question. There is more. Our sources highlight something called Eosinophilic esophagitis. We can call it EO for short.
EO. Okay. Sounds complicated.
It's a bit of a mouthful. Basically, it means certain immune cells, eosinophils, build up in your esophagus, the tube going to your stomach.
And that's linked to allergies.
Often, yes. And sometimes the main symptom someone notices is just a persistent sore throat.
Really? Just a sore throat?
Yeah, there was even a case mentioned, a 46-year-old guy, sore throat for a whole month. Turned out it was this allergy-driven EO.
A month? Wow. So a sore throat that just hangs around could actually be an allergy thing, not just a stubborn cold.
Precisely. It's a less common cause, but definitely something to be aware of if a sore throat just won't quit.
Okay. And you mentioned the nose stuff earlier, sinuses. Do they play a role too?
They definitely can. Allergies and sinus problems, like sinusitis, often go hand in hand. The research shows a pretty strong link.
Makes sense. Allergies cause inflammation everywhere up there.
Right. And if your sinuses are inflamed, you often get more of that postnasal drip we talked about.
So it makes the drip worse, which makes the throat worse.
Exactly. It's a bit of a cycle. One study actually found people with allergy symptoms had a much higher chance of having sinusitis, something like 22% versus only 7% in people without allergies.
That's a big difference. Okay, so allergies can cause sore throats through drip, maybe EO, maybe sinus issues. But how do you tell if it's just allergies? Or if it's something more serious, like strep?
Yeah, that's crucial. The sources give some clear warning signs if the sore throat is intensely painful, like really severe, or if you have a high fever, see actual white spots on your tonsils, or find it genuinely difficult to swallow.
That sounds more like an infection.
Exactly. Those point much more strongly towards a cold or another infection. Allergy sore throats are usually milder, more scratchy or irritated without those big red flags.
Got it. That's super helpful. Okay, let's switch gears a bit. Another thing you mentioned, a puffy face. We know allergies can make eyes watery, maybe a bit red, but like noticeable facial puffiness.
Absolutely. This often comes down to something called angioedema.
Angioedema.
Yeah, it basically means rapid swelling deeper under the skin. And the face, lips, tongue, eyelids is a really common spot for it during an allergic reaction.
Why does that happen?
It's tied to histamine and other chemicals your body releases during the reaction. They cause blood vessels to leak fluid into the surrounding tissues, hence the puffiness.
Okay, that sounds potentially alarming. Should you worry if your face suddenly puffs up?
You need to pay attention, definitely, if the swelling is sudden, severe, and especially if it comes with itching all over or trouble breathing.
Right, breathing trouble is always serious.
Always. That could be anaphylaxis, a major emergency, call for help immediately. But even milder facial puffiness can be a sign your allergies are acting up.
So what kind of allergens usually trigger this facial swelling? Is it the pollen stuff again?
It can be. Pollen from trees, grass, weeds, the seasonal ones, absolutely. But food allergies are also big culprits here.
Like nuts or shellfish.
Exactly.
Yeah.
Nuts, shellfish, milk, eggs. Those are common ones that can cause facial swelling, sometimes very quickly after eating.
Okay.
And insect stings, too. A bee sting can cause swelling around the sting site, but sometimes it triggers wider swelling, including the face.
Wait.
And don't forget the indoor stuff, dust mites, pet dander, mold. They can cause year-round issues, maybe even worse in fall or winter for dust mites when windows are closed.
So it could be lots of different things causing it. What about just puffy eyes? Dark circles, looking tired.
Yeah, that's related. That puffiness specifically around the eyes, sometimes people call them allergic shiners.
Shiners, okay.
It's the same basic idea. Inflammation and fluid building up in those delicate tissues around your eyes because of the allergic reaction. Your eyelids might look swollen, or the area underneath might seem puffy, maybe even a bit discolored.
Makes sense. It's all connected inflammation.
Yeah.
All right, let's tackle the big one. Symptoms that feel just like a cold.
The classic confusion.
Yeah. Sneezing, runny nose, stuffy head.
Yeah.
It's so easy to think, I'm getting sick.
It really is, because the symptoms overlap so much. Sneezing, runny, or stuffy nose, that sinus pressure, feeling both allergies and colds can give you those.
But what's the fundamental difference again, just to be clear?
The root cause. Allergies are your immune system overreacting to something harmless, pollen, dust, whatever. A cold is caused by a virus, an actual germ infecting you.
Okay. So how can you, feeling miserable, tell which one it is? Any key clues?
A few big ones. First, check the mucus. Allergy mucus is usually thin, clear, and watery. Cold mucus often starts clear, but can become thicker and yellow or greenish later on. Second, check your temperature.
The fever question.
Exactly. Fevers are common with colds and flu as your body fights the virus. Allergies typically don't cause fever.
Good differentiator.
Yeah.
What else? Body aches.
Yeah, feeling generally achy, muscle soreness that's much more typical of a viral infection like a cold or flu. Less common with just allergies. Allergies are more about the itchy eyes, nose, throat.
Okay, clear mucus, no fever. Itchy usually equals allergies. Thick mucus, fever, achy, probably equals cold. Got it.
That's a good rule of thumb.
Now, can allergies actually make you get a cold? Or make it worse?
That's an interesting point. Allergies themselves don't cause a viral infection, but that constant inflammation they cause in your nasal passages and airways, It can potentially make those tissues a bit more vulnerable. So if you are exposed to a cold virus, maybe, just maybe, it's easier for it to take hold, or the cold symptoms might seem worse because everything's already irritated.
Okay. So it's like allergies rough up the lining, making it easier for the virus to get in.
Sort of, yeah. Weakening the defenses slightly.
What about just feeling generally unwell? Like tired, headachy, that blah feeling. Can allergies do that too, like a mild cold?
Oh, definitely. Systemic symptoms, we call them. Fatigue is a big one for some people with allergies, even if they're sleeping okay.
Really? Just tired from allergies?
Yep. Headaches too, often from sinus pressure, but sometimes just a general headache. And just feeling uncomfortable in your head, kind of foggy, so you can absolutely feel under the weather from allergies alone.
Good to know it's not always in your head, or just need more coffee. Okay, let's focus on the eyes again. We mentioned puffiness, but what about vision? Blurry vision, watery eyes.
Yes, eyes are prime targets for allergies. That condition, allergic conjunctivitis, is super common.
Conjunctivitis, that's the itchy red eye thing.
Exactly. Redness, intense itching, and lots of watering or tearing. And when your eyes are producing that many tears or the lids are swollen,
your vision could get blurry.
It certainly can. Temporarily blurry or hazy vision is quite common with bad eye allergies. Sometimes dryness caused by the allergy or the antihistamines can also contribute to blurriness.
Okay, so if my eyes are itchy and watering like crazy during pollen season, a bit of blurriness might just be part of the allergy package.
It could well be, especially if it comes and goes with the other symptoms.
But when should you worry that it's not just allergies? When does blurry vision become a red flag?
If the blurriness is persistent, meaning it doesn't clear up even when your itching or watering improves.
Okay.
Or if you have significant eye pain, not just irritation, also strong sensitivity to light, or if your eyelids swell up dramatically. Those aren't typical allergy signs.
Pain, constant blurriness, light sensitivity. See an eye doctor for those.
Definitely. Especially sudden, painful, blurry vision, that needs checking out promptly to rule out other eye conditions.
Got it. So the usual allergy suspects for eyes are itching, redness, maybe some swelling, watery discharge, and sometimes temporary blurriness.
Correct. Triggered by seasonal stuff like pollen, or year-round things like dust mites, pet dander, mold.
And treating the allergy should help the blurry vision too.
Usually, yes. If the blurriness is directly from the allergies, managing the allergies with antihistamine drops or pills often clears it up.
Yeah.
If it persists despite treatment, that's another reason to seek medical advice.
Okay, now for something maybe really unexpected. Stomach issues.
Ah, yes. This is where it gets a bit less common, at least for inhaled allergies.
Right, I always thought stomach problems were more about food allergies. Can things like pollen or dust mites actually upset your stomach?
Generally, no. Allergies you primarily breathe in pollen, dust, mold, dander, mainly target your respiratory system. Nose, eyes, sinuses, lungs, stomach pain, nausea, vomiting, diarrhea. Those aren't typical reactions to inhaled allergens.
So if I'm sneezing up a storm from ragweed and my stomach hurts, it's probably two separate things.
Most likely, yes. The pollen isn't likely causing the stomachache directly.
Are there any exceptions?
There's a niche thing called oral allergy syndrome, or OAS. Some people with pollen allergies, especially to birch or ragweed, might get mild localized reactions like an itchy mouth or maybe slight nausea when they eat certain raw fruits, vegetables, or nuts that have proteins similar to the pollen.
Ah, okay, so it's cross-reactivity, but still usually mild mouth stuff.
Primarily, yes. Not usually significant stomach pain or vomiting. Also, remember angioedema, the swelling we talked about?
Puffy face thing.
Right. Very occasionally, that swelling reaction can happen inside the bowel wall that can cause quite severe abdominal pain, but it's not common from inhaled allergies.
Okay, so rare possibilities, but generally inhaled allergies don't hit the stomach hard.
Correct.
And just like with face swelling, if you do have stomach symptoms plus other severe allergy signs, that's an emergency.
Absolutely critical point.
Okay.
If you have stomach cramps, vomiting, or diarrhea combined with hives, widespread swelling, dizziness, or trouble breathing, that could signal anaphylaxis, possibly from a food allergy or insect sting, and needs immediate medical attention.
Right. Emergency signs always need action. So, bottom line, significant tummy trouble alongside your hay fever probably isn't the hay fever's fault. Look at what you ate, or maybe a stomach bug instead.
That's the most likely explanation, yes. Think food allergy, food intolerance, or an infection.
Okay, this is all incredibly helpful for sorting out these weird symptoms.
Yeah.
But let's circle back to that allergy versus cold confusion. It sounds important, but tricky.
It is important because treatments differ and, well, you want to know what you're dealing with. But yes, the overlap makes it tricky sometimes.
So, what are the most reliable ways to tell them apart? You mentioned fever earlier.
Fever is a big one. As we said, common in viral infections, very rare in allergies alone. Some studies show fever in nearly 90% of viral cases compared to maybe 2% of allergy cases. So no fever leans towards allergies.
Okay, check for fever. What's next?
Think about itching versus aching. Allergies often involve histamine release, leading to itchiness, eyes, nose, throat, sometimes skin.
Right, the itch factor.
Viral infections trigger different inflammatory pathways, often causing generalized body aches, muscle soreness, fatigue. Research backs this up. Itchy eyes are way more common in allergies. Body aches, way more common in viral infections.
Itchy versus achy. Got it. What about how long it lasts?
Another key clue. Allergy symptoms tend to be persistent, maybe waxing and waning with exposure to your triggers, like pollen counts going up or down. They often respond to antihistamines.
So they hang around potentially for weeks or months during a season.
Exactly. Viral infections, like a cold, typically run a predictable course, usually improving and resolving within, say, 7 to 14 days. Studies show allergy symptoms often stay consistent, while most viral ones clear up within 2 weeks.
So if it's dragging on, suspect allergies more.
That's a strong indicator, yes, especially if it lines up with known allergy seasons or exposures.
Are there tests doctors can do that really nail it down, besides just looking at symptoms?
Yes, there are some lab tests that can help. We mentioned eosinophils earlier. Those immune cells, often elevated in allergies.
Right.
Interestingly, during some viral infections, those eosinophil levels can actually drop, a phenomenon called eosinopenia. So high eosinophils suggest allergy, low might suggest viral.
Huh, that's interesting. What about those IgE allergy tests?
Allergen-specific IgE tests are crucial for diagnosing allergies. They measure antibodies against specific things like ragweed or dust mites. If those are positive, you have allergic sensitization.
Can a virus affect those tests?
A viral infection might temporarily raise your total IgE level a bit, but it shouldn't make your specific IgE tests positive for things you aren't actually allergic to. There are even ways doctors look at the ratio of specific IgE to total IgE to help differentiate.
Okay. Any other blood markers? like inflammation marker?
Things like C-reactive protein, CRP, or sedimentation rate, ESR, which measure general inflammation, might be slightly elevated with a viral infection. They're usually normal and uncomplicated allergies. It helps rule out infection sometimes.
So doctors have quite a toolkit. What about things we can track ourselves, like timing?
Absolutely. Pay attention to when and where your symptoms act up. Do they correlate with pollen counts? Worse after vacuuming. That points to allergies. Viral infections are spread person to person, less tied to environmental triggers like that.
And time of day. Does that matter?
It can. Allergy symptoms, especially from pollen, are often worst in the morning when pollen levels tend to peak after overnight release. Viral symptoms sometimes feel worse in the evening or overnight.
That's a useful pattern to look for. And seasonality.
Big one. Allergies often follow predictable cycles: tree pollen in spring, grass in summer, ragweed in fall. Viruses also have seasons: flu peaks in winter, rhinoviruses, common cold, more in spring and fall. But the patterns are different.
Okay, so lots of clues if you pay attention. Is it ever possible to have both at the same time?
Oh, definitely. You can absolutely have allergies and catch a cold. That can make symptoms really confusing and often feel worse.
Right. And I think you mentioned earlier sometimes viruses can almost mimic allergies.
Yes, that's a tricky one. Some viruses, like rhinoviruses, can actually trigger histamine release themselves, causing allergy-like symptoms even without a true underlying allergy. And both conditions involve inflammation, activating some shared pathways in the body.
So it's not always perfectly black and white.
Not always, which is why looking at the whole picture: symptoms, timing, history, maybe some tests is important for a proper diagnosis. Sometimes doctors might even suggest trying an antihistamine to see if it helps a sort of therapeutic trial.
Makes sense. Use the treatment to help figure out the cause. Now, this next part really caught my attention. The idea that a virus could actually trigger allergies. Not just mimic them, but cause them or make them worse.
Yes, this is a fascinating and quite complex area of research. It seems viral infections can indeed play a role in both worsening existing allergies and potentially even triggering the development of new allergic sensitivities.
How does a cold virus lead to, say, a new pollen allergy?
Well, there are a few proposed mechanisms. One idea is that viruses can damage the epithelial barrier, the lining of your airways.
Like we talked about before, making it easier for stuff to get in.
Exactly. When that barrier is disrupted, allergens that you breathe in might penetrate more easily and reach immune cells, potentially kicking off an allergic sensitization process you didn't have before.
Wow. So the virus sort of opens the door for the allergen.
That's one way to think about it. Viruses also cause a lot of inflammation and immune system activation. This general ramping up of the immune system might, in some people, disrupt the normal balance of tolerance, making the body more likely to mistakenly identify a harmless allergen as a threat.
So it messes with the immune system settings, kind of.
Potentially, yes. There are specific signaling pathways involving things called toll-like receptors, like TLR3 and TLR7, that get activated by viruses, and this activation might influence how the allergic response develops.
Okay. And what about making existing allergies worse?
Viruses can definitely exacerbate allergies you already have. For instance, some studies show the flu virus can enhance the release of histamine from mast cells when you're exposed to an allergen you're sensitive to.
So more histamine means worse symptoms.
Precisely. Plus, the inflammation caused by the virus itself adds on top of the allergic inflammation, making symptoms like congestion or wheezing more severe.
And you mentioned something about post-viral mast cell activation. What's that?
Right. Sometimes, after a viral infection clears, certain immune cells called mast cells can remain hyperreactive for a while.
The ones that release histamine.
Those are the ones. So even after the virus is gone, these mast cells might continue to release histamine and other inflammatory stuff, causing persistent allergy-like symptoms, even without ongoing allergen exposure. We've seen evidence suggesting this might happen after infections like COVID-19, for example.
So that lingering cough or sniffle after a bad virus might not just be leftover inflammation, it could be these overactive cells.
It's a possibility that researchers are actively exploring. It highlights the complex crosstalk between infections and allergic pathways.
It really sounds like a tangled web. Viruses messing with barriers, changing immune responses, making cells hyper.
It is complex. There are even specific molecular interactions, like enzymes on the flu virus potentially making cells more susceptible to allergen sensitization, or other viruses priming the system with inflammatory signals that boost allergic reactions.
So if someone suspects a virus might have triggered new allergies or flared up old ones, what are the signs?
The timing is often key. Did new allergy-like symptoms start weeks to months after a significant viral illness? Did existing allergies become much harder to control after you were sick? Those patterns are suggestive.
And can doctors test for this?
Diagnosis can be challenging. It often involves looking at the clinical history, maybe repeating allergy testing to see if new sensitizations have appeared, and sometimes checking markers like serum tryptase related to mast cells or specific inflammatory cytokines, though those aren't routine tests everywhere. Some might recommend allergy screening after recovery from certain severe viral infections.
Are there specific treatments if a virus is thought to be the trigger?
It's an emerging area. For virus-induced asthma flare-ups, which often involve allergies, specific antibody treatments like omalizumab might be used. There's some early thought that antiviral drugs like flu medications might potentially dampen the allergic response indirectly. And interestingly, probiotics are being studied to see if they can help restore immune balance after infections and perhaps modulate allergic responses.
Probiotics, like in yogurt.
Essentially, yes. The idea is to support a healthy gut microbiome, which plays a big role in overall immune regulation. But it's still early days for specific recommendations there.
This is all so much deeper than just taking antihistamine. Allergies are clearly more complex than most of us realize.
Absolutely. They can manifest in so many different ways. Some quite subtle or easily mistaken for other things like colds or even stomach bugs. And this interplay with viral infections adds another whole layer of complexity.
So wrapping this up, the main takeaway seems to be, really listen to your body. Notice the patterns, the triggers, the timing of your symptoms.
Exactly. Don't dismiss persistent or unusual symptoms. And if things are bothering you, especially if they're severe or long-lasting, getting a proper diagnosis from a healthcare professional is always the best step.
Definitely. And maybe, just maybe, think back.
Yeah.
Here's a final thought to leave you with. Consider your own health history. Have you ever had a really bad viral illness? Could there be a connection, however subtle, between that past event and any allergies or sensitivities you experience now?
It's a really thought-provoking question about the intricate dance between our immune system, the environment, infections, and allergens over our lifetime.
Definitely something to mull over. Thanks so much for breaking all this down for us today.
My pleasure. It's important stuff to understand.
Absolutely. Until our next deep dive, everyone, stay curious and take care of yourselves.